CSF drainage from ear, which is called otorrhea, and bruising over the mastoid bone indicate a fracture at the middle part of the base of the skull. While drainage of the CSF from the nose, which is rhinorrhea, in addition to the periorbital ecchymosis, the ecchymosis around the orbit of the eye, indicate that the fracture in the anterior part at the base of the skull. طبعا periorbital ecchymosis تسمى الراكون eyes. Sometimes the CSF may be mixed with blood. Drainage of the CSF from ear or nose could be mixed with the blood, as we said, and this makes difficult to distinguish between CSF and the blood. What is the halo sign? The halo sign, layering of a fluid with blood on the inside and CSF in a yellowish ring on the outside, and this could be appear when the area is webbed with a gauze. إذا أخذنا مسحة بجوز فنلاحظ أنه يتكون من الداخل حلقات من أو نقطة من الدم أو تجمع من الدم، وفي الخارج حلقة دائرية باللون الأصفر. هذا اللون الأصفر هو CSF. The most and significant definitive diagnosis for the fluid or the CSF fluid is the B2 transferrin test. Also, if the patient swallow the CSF, may feel sweety or salty taste during swallowing. الآن حكينا عن الفراكتشر of the skull. الآن ننتقل لنوع جديد من البرايمري برين انجري، وهو عبارة عن الكونكشن، وهو ما يسمى بارتجاج الدماغ، وهو عبارة عن temporary loss of neurologic function without apparent structural damage. فقدان مؤقت لبعض الوظائف العصبية من دون ما يكون هناك دمج ظاهر. There is an alteration in mental status result from a trauma. The patient may or may not lose the consciousness, but we have observed the patient for dizziness, headache, irritability, and anxiety, something called post-concussion syndrome. Short-term memory loss may be occur. The patient cannot recall the event that occurred before the falling exactly. يعني ممكن يصير في عنا سقوط عن دراجة هوائية، يخبط راسه بالحيط، يغيب ويقع على الأرض، ما بيقدر المريض يتذكر شو صار معه قبل هذا الحدث بالضبط. The recovery all was quick and complete. These symptoms like dizziness, headache, and mainly headache may last for months to years and can be alarming to patient and family. If the post-concussion symptom lasts longer than 3 months, the patient is described as having post-concussive syndrome. بشكي المريض عادة بعد أول أسبوعين ممكن تمتد لشهر أو 3 شهور من هيدك، فقط بحاجة إلى مسكن ألم ومراقبة. ممكن يصير يتحسس للضوء، يحتاج ممكن يشعر بديزنس دوخة، ويحتاج إنه فترة ريلاكسيشن وراحة. Discharge teaching must include review of sign and symptom of post-concussive syndrome. فقط ممكن نعمل المريض CT scan to indicate that there is no intracranial damage or bleeding. A more severe injury is the contusion كدمة. More severe cerebral damage in which the brain is bruised with possible service bleeding. ممكن يحدث فيه bruising و service bleeding. This injury spread into deeper layer of the brain. They range from mild to severe depending on the location, size, and extent of injury. The patient has decreased depressed level of consciousness and may enter in coma. The diagnosis by CT scan and MRI and indicative of damage inside the brain, accumulation of blood, bleeding, edema that may lead to increase in intracranial pressure. Contusion, the patient lie motionless, cold pale skin, shallow respiration, and decreased blood pressure. نتيجة للبرين انجري، نتيجة الكونتيوجن، نتيجة الفولينج داون، ممكن يصير في عندنا اشي بنسميه epidural hematoma نتيجة أسباب أخرى، ممكن يكون نتيجة الهايبرتنشن مثلا. آه ممكن يصير عنا damage or rupture of the middle or meningeal artery and accumulation of the blood above the dura, between the dura and the skull. These thing needs surgical intervention to evacuate, to remove the hematoma. The patient could be conscious or in coma. Intracerebral hematoma, collection of the blood within the brain tissue caused by disruption, damage to the blood vessels. Depressed skull fracture, penetrating injury, stab wound, hypertension, aneurysm, anticoagulant therapy. Systemic disorder like hemophilia may lead to intracerebral hematoma. One of the major causes is the hypertension. This need craniotomy اللي هي عملية دماغ كبرى. This picture clarify that there is a subdural hematoma bleeding under the dura, epidural hematoma bleeding between the skull and the dura, and intracerebral hematoma, which is the most difficult one.